Good morning, everyone. Thanks for joining with us this morning. We have a lot to cover today, so I'm going to go ahead and get us started. I just want to welcome you all to this conversation about the impact that smartphones and social media have had on youth mental health and what states and schools can do to help reverse this alarming trend. We're really at the start of a movement to reverse the impact that smartphones have had on youth mental health, and the people we have here with me today leading this discussion are catalyzing that movement. I'm very excited to have this discussion. You know, when I first read The Anxious Generation, I was struck by how profound and clear the takeaway was, that the rise of smartphones and loss of unstructured playtime have had a direct, traceable negative impact on youth mental health. But what was more important to me about the book was that the book went beyond just identifying the trend, but also suggested real actionable steps that we can all take as a society to reverse it. Schools and families, we can create the change we need. And today we have over 800 educators, administrators, and even legislators assembled.
Awesome.
And I'm hopeful, you know, my goal for our conversation today would be that each of you can take away something that you can implement in your communities. My name is Alex Alberto. I'm the CEO at Daybreak Health, where we support schools and families in ensuring that every child has equitable access to mental health support. The Anxious Generation book has actually directly impacted our work as we've integrated modules on smartphones, social media, and play into our family education programs that complement the teletherapy programs we provide to districts and families. So I am truly honored to have John with us here today, along with leaders in the education space that are creating this change in schools. And I'm going to go ahead and introduce our panelists now, and we will dive into the discussion right after that. Let me share my screen. We have four panelists joining us today. The first, and probably why many of you are here, is the author of The Anxious Generation, John Haidt. He's been on the New York Times bestseller list for 6 months, and with his newest book, The Anxious Generation, but I've been following his work for many years, and he's been studying the contributions of social media to the decline of teen mental health since 2018. So really excited to have John here today to talk about his research and what can be done in schools. Welcome, John.
Thank you, Alex.
Next up, we have Superintendent Tony Thurmond. He is California's 28th State Superintendent of Public Instruction. Prior to that, he was the superintendent at several LEAs and districts across the state of California. And we've done work together over the years. He's been a fierce advocate of promoting student mental health and wellness, including rolling out teletherapy guidance for schools across California. And most recently, championing the legislation that was passed in California that was really first of its kind to limit cell phone use in all California schools. So really honored to have you here with us today, Superintendent Thurmond.
Thank you. Good day, everyone.
And finally, we are very excited to have two folks from LAUSD here with us today. Superintendent Carvalho, who is the superintendent at LAUSD since his unanimous vote in 2022. And prior to that, he was at Miami-Dade. And Nick Melvoin, who's on LAUSD's board and was instrumental in developing the phone-free policy for LAUSD. LAUSD is the second biggest district in the country, and they've been a huge leader in mental health. In June, the board approved a resolution for the superintendent to develop a policy implementing phone-free school days, making it the largest school district in the nation to take that step. So we're very honored to have them here today, and Daybreak is actually launching a partnership as well with LAUSD this fall to provide mental health and education support for families. So welcome, Superintendent Carvalho and Nick. We're very excited to have you here.
Thank you.
All right, with that, let's get to the discussion. I want to tee up a few topics today. We'll cover 3 topics sequentially, and we'll bring in the different panelists at different times for their various areas of expertise. First, we're going to talk about the change we're seeing in youth mental health and the direct correlation of that with the rise of social media and cell phone usage. So I'll ask John to lead us through a conversation on that, and the educators to say what they're seeing as well. Right after that, we'll jump into the role that schools can play in solving this issue. And we'll start broad with youth mental health in schools, and then we'll narrow into the self-harm restrictions and what we're seeing in bringing this movement about. And then finally, because we know that schools are really a big part of the story, but there's also the home life to worry about. We'll talk about the importance of family education and ensuring that good habits stick at home and the roles that schools can play in educating families. I think this discussion will take about 45 minutes, and then we'll open it up for questions. Feel free to drop questions in the chat throughout our time together. Also, feel free to introduce yourself. And we'd love to see who's joining us today, and we will curate some of those questions at the end. All right, let's get started. So John, I'll kick it off to you first. Let's start with just the change that we're seeing in youth mental health and the correlation with social media usage, smartphone usage. Can you share a little about the research and the data that you learned in writing The Anxious Generation and some of the key outcomes?
Sure. So I first noticed the issue, as many college professors did, in around 2014, 2015. The students coming in were just really different from anything we'd ever seen. They were more anxious. They were asking for trigger warnings for great books. It was very, very different. We didn't understand it. And my friend Greg Lukianoff and I wrote an article in The Atlantic called "The Coddling of the American Mind." And originally we thought that somehow colleges were teaching students to think in this way. But a couple years later, we got the data from The Nation, and it turns out, no, it's not about college. It's everyone born after 1995. It's Gen Z, whether they go to college or not. Levels of anxiety, depression, self-harm, all were pretty stable from the late 1990s through 2010, 2011. There's really no sign of any change. And all of a sudden, around 2012, the numbers just go shooting up. For boys and girls, although the overall increases are usually bigger for girls. So we had a teen mental health crisis. It exploded out of nowhere. There was no sign of it in 2011, and by 2015, it was everywhere. So those are the basic facts. As I began studying this, so originally I wrote a book called "The Coddling of the American Mind." We went into the role of overprotection. We speculated maybe social media has something to do with this because the timing is right, but we didn't have data on it back then. Well, beginning in 2019, I really began to collect all the data I could find. And it turns out that there actually is a lot of data that it's not just social media, it's the transition from a play-based childhood, a normal human childhood where kids are doing things in the world and developing social skills and making eye contact and getting sunlight in their eyes and all the things we think of as part of childhood. That kind of ends between 2010 and 2015 as millennials trade in their flip phones for smartphones with social media. And the first kids who went through puberty scrolling on social media, they became Gen Z. That's the origin story of Gen Z. And we have correlational evidence that the kids who use it the most are the most depressed. We have experimental evidence that when you ask people to go off social media for a few weeks, they get less anxious and depressed. And we have huge amounts of eyewitness testimony from people within the companies. Now, the companies don't tell us this. They tell us that their products are good for kids, that it's a lifeline for depressed kids and rural kids. But none of that is true. Their internal memos show they know that they're hurting millions and tens of millions of kids. Snapchat gets 10,000 reports of sextortion a month, not a year, a month. And that's just the ones that are reported. So the number is much larger than that. So we have massive harm to a generation. Once they were all hooked up to phones and social media, for the boys also, we have to bring in video games and pornography. We have a rewiring of childhood. We're blocking their social development, blocking their intellectual development, blocking their cognitive development. And we see this not just in the mental health, mental illness levels going up. We see it in educational levels going down since 2012, not since COVID, since 2012. And it's not just us. It's many countries. It's all the English-speaking countries and many other countries besides. So we have a global crisis, declining mental health around the world, declining test scores around the world. And there's no other theory. Nobody even has offered another theory for why this started around the world around 2012. So I think we got to do something about this, and schools are the place to start.
I appreciate you sharing that, John. And I think we've all seen the impact in our day-to-day lives with our kids and the people around us. So I don't think anyone will disagree with the shift that we're seeing. I would love to hear a little bit, Superintendent Thurmond and Superintendent Carvalho, from you two on John's second point, which is it's not just that smartphones are impacting youth mental health, but there's a direct correlation with academic outcomes as well. So would love to hear you talk about what you're seeing, what you've seen over the last decade in your work in schools, and the relation between smartphones, mental health, academic outcomes, and the role that you think cell phones have played in that.
Well, good day, everyone, and thank you, Professor Haidt, for your research. And thank you, Daybreak Health, for bringing this conversation to the forefront. You know, I would just say that our state is ready to take on this conversation about limiting the amount of cell phone use during school time, but I think we have to go beyond that and really address mental health needs of students beyond school time. You know, I think this is bigger than just putting a phone in a pouch, but I think acknowledging that, you know, students get less sleep time, less quality sleep, but there's no question that everyone who has limited a phone use during school time has seen an improvement in academic performance, has seen an improvement in social conditions, fewer behaviors, less bullying, just less disruption. And so I believe that California is ready for this. Obviously, it's a hard conversation. You know, for me, even as a parent, you know, of a 21-year-old and an 18-year-old, two great daughters, when my 18-year-old started her senior year and her school staff said, hey, you got to put your phone in a pouch, she was anxious about that. Mm-hmm. And I was, you know, what does this mean? You know, if there's an emergency and I can't reach my child. We both settled in and realized that there are more benefits to this than any downsides. And given what we've seen throughout the pandemic in terms of the high levels of anxiety, depression, suicidality, we know that this is an important step to addressing the mental health and the well-being of the 6 million students in our state. And we hope that other states will follow and do the same for their students as well.
Good morning, everyone. Thank you so much for this opportunity to discuss this critically important issue. I want to thank, first and foremost, Dr. Haidt for the compelling and informative research. As you've heard already today, extensive research has shown real links between excessive mobile phone use and mental health problems amongst our youth. We've seen it here in Los Angeles. It is seen, as you heard, across the country. It is seen across the world. What we've seen in Los Angeles Unified is consistent with the published research and, quite frankly, the book that Dr. Haidt has written and published. Our school-based psychiatric social workers are dealing with increasing cases of students showing signs of anxiety, depression, and even suicidal ideation. Across the country, we've also heard about increasing rates of bullying, and not just the traditional fistfights after school. We're talking about cyberbullying. Phones and other mobile devices are making it easier for young people to bully one another away from the eyes of adults, which is a major problem we're dealing with. Mobile devices can also interfere with safety. We hear a great deal about how students need their phones in the event of an emergency, but what we've actually seen is that the use of phones among students actually interferes with their ability to focus and follow procedures during crisis. Finally, you know, mobile devices are really contributing to a rise in substance use and abuse in two significant ways. First, the increase in mental health issues we've discussed is directly linked to higher rates of substance abuse. What's even more alarming, honestly, is how mobile devices are making it easier for students to find and acquire illegal substances. It's never been easier. This is yet another reason why limiting phone access can help keep students both physically and mentally safe. As far as the direct impact on not only academic performance, but also attendance, chronic absenteeism, we have documented in our district that, consistent with the research findings that Dr. Haidt addressed, there was a significant decline in terms of academic proficiency, particularly in reading and mathematics. We believe that is attributable to a loss of focus, a distraction not only in the classroom in school, but also at home, a devotion of time to activities that are web-based, not social interactive based, the lack of interaction with peers of like ages. And I think those are all contributing factors to a decline both in attendance as a result of increased anxiety, but also academic performance. With that said, we are seeing a rebounding of academic performance through the great work of our teachers and leaders and support staff, but one cannot ignore the well-documented, the well-researched body of evidence that certainly ties these social, emotional, psychological effects, academic performance issues to the use and abuse of cell phones, which, by the way, are only vehicles to the information that is accessed through these phones. So we cannot leave the titans of social media entities off the hook. They are responsible for creating complex algorithms that entice, captivate, and addict our kids to the products and the imagery and language that quite frankly keeps our kids distracted and in a mental position that is dangerous to themselves.
Thank you for sharing, both of you. Superintendent Thurmond, you said something that really stuck with me, which is the cell phone restrictions can help, but at the end of the day, we need to do more than just putting a phone in a pouch. The mental health crisis is bigger than that. It's broader than that. So I want to, before we dive into the details of the cell phone restrictions and how we've seen that play out, I'd like to level up for a second and just talk about the role that we all think that K-12 education should play in supporting youth mental health, supporting student mental health. And so, John, I'd like to start with you. You write a lot about this in your book, how K-12 and schools can be part of the solution around youth mental health, around the anxious generation. So please just talk a little bit about some of the interventions and suggestions that you have. You might be on mute.
Years after we all got into this, I still make that mistake. So the easiest step, the very low cost, very high benefit, is to go phone free. And California and LA are leading the nation and inspiring the nation. We almost got it in New York City, but there were complications, and I don't know what's going to happen there. So thank you for doing that. It really is making it easier for other states to do that. A big part of my book is about how we're all stuck in this because of what are called collective action problems. Each of us parents at home, we want to keep our kid off, but our kid says, I'm the only one. I'm the only one who doesn't have a phone. I'm isolated. And so we give in. What we need is a set of simple norms that families can follow. Well, who can propose the norms? The president of the country? I mean, maybe, but that's not really relevant. By far the best place to propose norms for parents, especially of any age, is the school, because you have a whole community of people who are all focused on the well-being of these kids. They trust you on a lot of things. I maybe not on everything. I have no idea. I hope they do. But at least if you say, here's what we're doing in school. We are going phone free. The research backed this up. We want our children to be learning, paying attention. But you know what? This mental health problem is so big, we all have to work together. And while I understand, especially in public schools, you're often reluctant to tell people what to do at home, but you can propose norms. If you were to say, we're doing this in the school and we're getting great results, we encourage you to follow the norms laid out in The Anxious Generation. It's 4 simple norms. No smartphone before high school. Just give them a flip phone before that, or a phone watch. No social media till 16. It's wildly inappropriate for minors for the reasons that Superintendent Carvalho was saying. Phone-free schools, which you're already doing, and far more free play, independence, and responsibility in the real world. So schools are so well positioned to put out the norms. And believe me, most parents want the guidance. They're all struggling alone, but when it's the whole school community, they're going to welcome it, and you're going to get great results on mental health. I just want to close by saying we're all focused on the phones. That's the focus of attention this year. But as Alex pointed out, the book is about the loss of the play-based childhood and its replacement by the phone-based childhood. So there are a couple of things you can do at school to easily give much more play. And if you have more play in school and less phone and drama and bullying, well, then kids are going to like school more. They're going to have more fun. They're going to have more friends, and you address your absentee problem because they're going to want to come to school. I urge everyone on this call, go to letgrow.org. It's a nonprofit I co-founded with Lenore Skenazy, who wrote the book Free Range Kids. Look at the Let Grow experience. It's a project you do, school-based. Kids go home, they work out something with their parents. Let's say you do it in every third grade classroom in California. They go home, they say, Mom, Dad, I need to propose something that I can do with your permission, but without you. And we have examples like maybe it's walk the dog. Maybe you've never walked the family dog, or maybe you've never walked 3 blocks to a bodega or a supermarket, whatever's nearby. An 8-year-old can do that. We all did that at age 7 and 8. We were all out. Our 8 and 9-year-olds, they can be doing this. So if you do the Let Grow experience, amazing things happen. We have evidence at Let Grow that it actually treats anxiety, and it's much faster than Prozac because it works right away. When kids do something and then they're jumping up and down with excitement about their new competence, they're more confident that day. So please do the Let Grow experience. It really brings a lot of independence, confidence. It's going to really help you to bring down anxiety levels and just raise more competent kids.
It's really helpful, John. Thank you for sharing. I remember in reading your book, there were also a couple of specific suggestions for schools, including but also outside of family education, things about recess,
Yes.
And lengthening the time that students have to actually interact and play in an unstructured way during the school day. Could you share a little bit more about those as well?
Oh, yes. Oh, thank you for bringing that up. I didn't want to go on too long before, but this is so important. So in the book, I talk about the need to make schools phone-free and full of play. And it's especially in elementary school and really all the way even through middle school. They're still kids. They need to play. Play is not just like something to make their day better. Play is a biological necessity. All mammals play. If you've had a puppy or a kitten, they play, because that's what you need to do to wire up your brain. That's how we're built. And we've been taking that away from kids since the 80s with the incorrect idea that, well, kids need more math time, more reading time, more of the, they, especially at the young age, they need a lot more play. We've taken away play. They're unhappy. They can't focus. If you give them more play, recess in this country is down to about 25 minutes a day, according to some statistics. I mean, it's shameful how little time we give recess. Federal inmates in a federal penitentiary are guaranteed 2 hours a day of yard time, but our kids only get 25 minutes. So anything you can do to give longer recess with less supervision, let the kids make up their own games and then play the games, give them time. Don't just crowd it all into like lunch and recess. So give them more play. Also, a lot of your families may not feel comfortable letting their kids go out on the street at age 8, 9, 10, but they almost always trust the school and school playground. So at Let Grow, we propose what we call the Let Grow Play Club. It's just it's an after-school option. Anyone can sign up. And let's say you sign up for Friday. So you and 20 other kids, you're on or 50, whatever it is. It's a group that's always together on the playground on a particular day, unsupervised. There's a person nearby, but not like blowing the whistle and saying, hey, stop running. So the school playground is an incredibly important resource, especially in communities that don't have access to parks and just general outdoor play space.
Thanks, Sean. It's so powerful. It's so simple and so powerful how these two things can work together. A phone-free playtime can be so beneficial for helping students and youth grow and improve their mental health. Superintendent Thurmond, I want to turn it over to you a little bit. Feel free to react to anything that John said, but I know that you have a background as a social worker prior to becoming a superintendent. And I wanted to give you space to talk about some of the things that you've worked on as well to support student mental health broadly, because I know you've been such an advocate for helping reverse the trend of declining student mental health that's been occurring over the last decade.
Yeah, I would echo the things that John has said. We've known for decades that play-based learning supports students, and it's not just playing games, but it helps students to be engaged. I'm grateful that we have great districts like Los Angeles Unified, that are showing that even a very large district, the second largest in the country and the largest in our state, can implement these types of policies around limiting cell phone time and engaging students in things that are going to really help them. We look forward to putting out guidance for our 1,000 school districts that we think will help them, but we're also going to be asking for feedback. I got to spend some time with some students last week. They attend various schools in Monterey County. And when I walked in and we started talking about cell phones, they were upset. They were like, why would you limit the cell phones? And when we got into the rationale, these were mostly high school age students, they were very open. They said, thank you for telling us the reason why. They couldn't argue with the benefits. And, this state's doing really interesting things. I think there are ways to integrate play and learning, as well as reinforce math and science and other topics through other mediums. Our state gives $1 billion for arts and music instruction. To me, the whole message is take some time away from your phone and social media and do something fun that you love, whether that's after school activities or sports or music or drama, whatever that might be. We engage our students in service learning. We want them to be involved in community service where they help others, in civics where they do things to help others in the community that's really helping themselves. And so I just think that there's so many great examples of ways to do this, and everyone has a role. I think at the end of the day, families have a responsibility too. In addition to the school limiting cell phone time, I think families have a responsibility to also limit cell phone time, and the social media companies have a responsibility here. So interesting. Superintendent Carvalho talked about this algorithm. To me, this is the thing that drives young people and adults down the rabbit hole by design, so that you stay connected to your device. And the interesting thing is when you talk to CEOs of technology companies and social media companies, they will say, we don't allow our kids to have a lot of screen time. They know that there are these potentially damaging effects, but yet they're profiting off of it. And so when we held our hearing on the legislation to say that cell phones would be limited in school, we invited the social media companies. We said, look, we expect you to be a part of the solution for addressing and offsetting and mitigating these mental health challenges. They didn't show up to the hearing. Surprise, surprise. Having said that, we're not going to let anyone off the hook. We all have a responsibility. And I can just see how, it's just ironic to me, Alex, that our greatest challenges around mental health came at a time when we had fewer mental health clinicians to address the needs of our students. Even prior to the pandemic, the data shows that there were about 1/3 of the mental health clinicians needed in the state of California, especially in rural areas where there's not a lot of access to healthcare. And then the pandemic hits, and now everyone is isolated. And so, we're not people who are used to being isolated. We're used to being connected. And so everything is just sort of coming full circle and reminding people that we need to find ways to make connection, and that if we have balance, cell phones can be a tool. Social media and the internet can be a tool to advance learning, but everything has to have balance. And so what we're going to continue talking about is how we help young people, how we remove the stigma around talking about the need for mental health. The 988 movement is very active in California, where young people or adults can text or call that number or chat to talk with a mental health professional 24 hours a day, 7 days a week. In our state, we're providing a $20,000 scholarship for anyone who wants to become a mental health clinician and commit to 2 years in our schools. And so, we think that there's a lot of work to do, but things are coming together. We want to promote best practices around mental health. We want to encourage alternatives to just being on one's phone or on social media, and exercise balance, to use technology as a tool. I know the superintendent is a champion of using technology and AI and in education to benefit what great teachers and staff do. But we have to have balance, and I think that will ultimately benefit us all as we move forward.
Thanks so much for sharing, Superintendent Thurmond. The state of California is doing a lot across the board to be a leader in this space, and really appreciate your leadership in everything that we're doing. I would love to turn now to the topic du jour, and let's get a little bit deeper on the cell phone restrictions. And there's kind of a couple angles now that I want to get to here, and I want to bring in our LAUSD folks. But I do want to start back with you, Superintendent Thurmond, just talking about the recent bill that was passed, and then I'd love to turn it over to Superintendent Carvalho and Nick to talk a little bit about how they've implemented the cell phone restrictions in LAUSD. But let's start with the bill. You championed the passage of Assembly Bill 3216 over the summer that would limit the use of smartphones in schools by 2026. How did you get this bill in motion? What made it a reality at the policy level?
Thank you. I think through dialogue, I think while we have great examples already in Los Angeles and San Mateo County and other places, I think people have questions. How will this policy get implemented? And so I envision that our office will put some guidance out to school districts that will provide some examples of how to do this, and we'll just have dialogue. What LA Unified is doing is a great opportunity for us to showcase what's already working and how this can work, and to help our school districts find alternatives to students using their phone during school. So that would be the first step: is guidance, training. School districts are looking for resources on how to purchase, make purchases of the products that they can use to store the phones. They have questions about what to do in emergency situations. And I want to thank the folks at Yonder who have the pouch that many districts use. They shared with us some informal research that they've done in how they've helped students who need to have their phone available because of a medical emergency situations, that there are pouches that can stay open or that unlock easily. There are ways to work through this, and many of our districts already have worked through the scenarios. And so we'll be turning to our districts to make sure there's lots of input on how these policies play out. And so, but we're preparing to put out some guidance and to have some dialogue and to do a lot of listening as much as we're sharing to make sure that we're capturing the needs of our very diverse districts all across the state.
Thank you for sharing. And it's an exciting spark to, I think, a big change that's coming, and it's really exciting, Superintendent Carvalho and Nick, to have you both with us as, really the first really big district in the country that has taken this big step. You guys have always been a leader, LA Unified, and other districts watch what you do. We talk to a lot of districts every day, and everyone's looking to what LA Unified is doing. So excited to have you here, and I'd love to have both of you talk to what inspired you to support a phone-free policy and some of the steps that you're taking to roll this out.
Well, I think it actually would be appropriate for board member Nick Melvoin to speak first, because he was the sponsor, the original author of the resolution that brought about a significant change to our existing policy, which, by the way, LAUSD has always been a trendsetter. We already had a policy limiting student phone use in classes for about a decade, but the new policy is significantly different because it is wrapped around the research that Dr. Haidt addressed. It is not enough to limit phone use during class time. Kids need to be kids. They need to play. They need to socially interact with one another. And I think that is the revolutionary nature of the board resolution that Nick brought forth. So, Nick?
Yeah, well, thank you, Superintendent, and thanks, Alex. It's great to be here. Big fan of you and all that you're doing, and with Superintendent Thurmond and Jonathan. I listened to all of Jonathan's books on tape, so hearing him on a webinar, it's like, in the presence of celebrity. But yeah, I brought the resolution that the board passed in June, and I'm really grateful that since that resolution was passed, creating cell phone free days in LA, that not only did the state follow suit, but also that now almost half of American kids in schools are in phone free or phone restricted schools. And I really need to thank Jonathan, because I think, and I'm sure there are folks on this call who would agree, a lot of us who have spent time in schools, I'm a former middle school teacher, I've been on this board for 7 years, who spend time in classrooms and in schools every week, have seen this, have seen what we were describing and felt just intrinsically. We saw kids surreptitiously scrolling on their phones in class time, much more, thinking they are more subtle than they are. And this isn't unique among children. We're the same way, right? At a dinner party or at a restaurant, I saw kids walking down the hallway with their head in their faces, not looking at one another. We saw kids out on the yard, not talking to one another, but on their phones. And I think we were all just looking for the political will and the opportunity to do this. And Jonathan's book really created that. And I know there are folks, again, who are on this call who I think feel the same way. We needed the zeitgeist, if you will. And I think that's what this book did. People are starting to talk about it, and we're all realizing, yes, how is it that we haven't done this yet? And I really think for the schools that are early adopters, they're also going to realize I can't believe there was a day where we let students have their cell phones during the school day. But so really it was, after spending years in classrooms talking to teachers about this, I think there was a Wall Street Journal cover story months ago about a teacher who quit after 8 years just because he was spending so much time policing phones. We had a teacher testify at our board meeting who said she had to create phone monitors within class, like kids had to rat each other out because she was too tired of just policing this. And so ultimately the time had come for the district to take, I think, a bolder stance. And like Jonathan was saying, and the superintendents have as well, this was the perfect collective action problem. One teacher said, well, if I enforce it, I'm the strict teacher, I'm the bad cop. One school said, I want to do it, but then parents are saying, this other school's not going to do it. Kids are saying, this FOMO, this fear of missing out. If I'm off my phone all day, my anxiety is actually going to increase because I can't text with my friends at the other school. So it was the perfect opportunity, I think, for the district to come in and say, we're going to lead on this. And I think as school board members and superintendents know on this webinar, school boards get to come and say, superintendent, well, you do the hard stuff, we'll take credit for it. And so that's basically what we did with the resolution is we tasked the superintendent with coming back to the board with a policy that restricted the use of cell phones from bell to bell and also took into account things like smartwatches and social media. This was at the time, the day our board adopted the resolution was the day the Surgeon General came out with his suggestion that we should have warnings on social media labels the way that we do on tobacco products. And so it was really, spending time in schools and seeing the deleterious effects across the board and also hearing from students. And I'll turn it over to Superintendent Carvalho to talk about the plan that his team has worked on, because I think it will be a model, not just nationally and internationally. But I'll say that one of the things that's surprising, I'm sure, to folks on this call is that schools that have implemented this, it's actually the students who are very grateful and don't want to go back. And I was at a school the other day with a high schooler who said to me, and I wish we could bring him on webinars like this, but he said to me, I am so grateful that the school respects the relationship I have with other students enough to get our phones out of the equation. And I know that not everyone's going to be there right away, but I think they're going to get there. And so I'll turn it back to Superintendent Carvalho to talk about actually the implementation, because a lot of that is where this is going to succeed or fail.
Thanks, Nick. Just very briefly. Number one, the point that Nick just made, look at what's happening across the country. Considering the size of Los Angeles Unified, we know as LAUSD goes, so goes California. As California goes, so goes the nation. So we have a terrific opportunity here to set policy and implement this policy through reasonable practices that actually will influence and make it easier for the adoption of these policies and practices across the country. There'll be no excuse. Look, we first of all engage stakeholders, researchers. We read Dr. Haidt's book over and over again, spoke with researchers, spoke with technology entities, spoke with parents, students, educators themselves, principals, to hear their voice and incorporate their voice into the development of the policy that will be enacted in the first quarter of 2025. What we are seeking, quite frankly, is to provide very specific guidance and place additional restrictions on mobile device use from bell to bell. We anticipate, quite frankly, as I believe Dr. Haidt indicated, that when we begin to implement this policy, students will organically actually revert back to pre-smartphone behaviors. They will talk to one another. They will interact more with one another. They will reach different levels, higher levels of joy. They will develop critical social skills during their formative years and adolescence, and all of that will translate into decreased levels of chronic absenteeism and improved levels of academic performance with less referrals to mental health professionals in our school system. We impact attendance and tardiness to go down. And look, initially it's not easy. Yes, there was a bit of pushback, but number one, we are not New York. Once you know better, you have to do better. The research is compelling. And you cannot just fold when there's some opposition to something that is so widely known as being the right thing to do. So where are we right now? Number one, we recently informed the board via a memorandum about the steps that we have taken, the steps we'll be taking. We are a massive school system, over 700 school entities across Los Angeles Unified, and we're going to empower, with budget attached, schools based on their internal decisions to adopt different approaches to the policy. But whatever the approach is it needs to separate the student from the phone. So in some schools, they will be adopting technological solutions like the pouches. In other schools, particularly at the elementary and maybe even middle school level, it will be an honor system or the storage of the phones in the classroom in sleeves or little drawers. At the high school level, look, we know if you love chocolate, probably as long as there's chocolate, you're going to eat it. Separating the student from the device is going to be a key to the success. So we're looking more at technological solutions for the safe storage of the phone with the student through pouches. California law will require that the student have access to the phone in case of emergency or crisis. We're also being sensitive to the exceptions, and this was key as Nick drafted his resolution as we began formulating the plan. We have plans for students who are medically needy, for example, students who are insulin dependent, where they get the readings to their cell phone to continue to have access to their phone. English language learners for the purpose of translation, right? As well as other students who have real legitimate use for their cell phone during the school day. We are going to begin this implementation January of 2025. We're going to give about 3 to 4 months of grace period, monitor the implementation, and for schools that opt to go with an honor system, meaning, hey, there's the policy, don't take the phone out of your backpack, we will still make an investment into those schools for the students who may violate the policy. And those will be the ones required to place their phones into the pouch or another type of technological device. We do not anticipate significant issues with the implementation of this policy. As Nick said, students more and more are coming to us and saying, you know what, particularly in the schools that have already implemented these policies, and we have a few dozen schools that have done so, they are relieved, they are more focused, they are less distracted, and we've seen tangible reductions in the level of anxiety that these students are manifesting, the level of depression, and higher levels of attention while in the classroom. The same is coming from our teachers who reflect on a more educational environment in their classrooms with less distractions.
Alex, can I just put in 2 quick points? Building on what both superintendents and what Nick was saying. So just very briefly, the policy has to be bell to bell. Many schools say, oh yeah, we're phone free during class time. And that's a disaster because that means everyone has to be on their phone in between classes and at lunch. And the research shows teachers say that policy, the phones are incredibly disruptive. The only policy that works is bell to bell. Now, on the point about security, and that's the major pushback that we get. Parents are afraid to not be able to contact their students, their kids. They want to be able to hear their voice if there's an emergency. And so what I suggest to everyone on the call, when you face parents who say this, when you face opposition, and always the question, what about school shootings? Our kid has to have a phone. What you say is, what I say is, look, I'm a parent of teenagers. My kids go to New York City public schools. If there was a shooting, God forbid, I would want to be able to reach them. I would want to hear that they're okay. But we have to do what's best for the kids, not what's best for our feelings. And the school security experts all say, if there's an emergency, what you want the kids to be doing is being quiet, doing what they drill to do, following directions, being alert. That's what you want. What you don't want is all the kids calling their parents and crying. That is a disaster for their safety. So, you can be empathic, but then you say, look, we have to do what's best for the kids.
I appreciate you interjecting those 2 points, John. And I'd open it up to the group if you actually anticipated my next question, which is what's some of the feedback that anyone here has been hearing from parents about rolling this out, whether it's the shooting concern or otherwise, and how have you all dealt with that as you've rolled out these policies?
Yeah,
Well, Alex, I'll add one thing on the basis of what Jonathan just said. Our policy actually is going to extend not only during the entire school day, but for students who are in before school or after school enrichment activities, the policy will continue. It's critically important for them to benefit from the policy during that extended period of time. And I appreciate the comments made about the safety and security concern. We are sensitive to that. And initially, a lot of parents did bring that concern to us. And what we've been telling parents is exactly what Jonathan said. That's exactly the response. From a law enforcement perspective also, based on the experts we've spoken with, they've said dozens or hundreds of calls coming in with mixed messages about what's taking place in the school may actually hinder the effective law enforcement and first responder action that follows these types of crises.
And I'll just add, Alex, yeah, a couple things. We do hear pushback about emergencies. I think one of the things, and I appreciate Superintendent Thurmond's leadership on this, I think as this evolves, state law requires an emergency exemption, but it's unclear what that is. And so schools and school districts are saying, what does that mean? Does that mean that the student has to be able to access the pouch themselves? Does that mean the phone has to be in the classroom? And I know we have some legislators on here. I know we kind of throw those things in. Oh yeah, as an emergency exemption, but I think we do need guidance on what that actually means. I also think it's incumbent upon schools to be better at communicating with parents. Because when you remove this tool that parents have been now relying on, not only for emergencies, but, oh, the bus is going to be late, or your dad's going to pick you up, not your mom. When you take that access away, schools then have to figure out what their system is. Do you call the front office? Do you do robocalls or texts? And so I know that we've been trying to own that and say it is going to be incumbent on us to make sure that we're communicating with parents more. And then just the other pushback that we've gotten a little bit is, well, isn't the toothpaste out of the tube? Like, why aren't you teaching kids to be, good users of their cell phones? And I think, and I can see from Mr. Haidt's, expression, he's dealt with this too. One, kids' brains are developing at different things at different levels, but also the more salacious example that I say is there are a lot of things that we teach kids about without encouraging them to do it in school, and sex education is my go-to. We teach it, we don't encourage it. And I think we are talking about digital citizenship and how kids can be responsible users without them being on their cell phones. But that is one I hear from a lot of folks as well.
I would certainly echo the comments that have been made about the safety of our students. There's really nothing more paramount than that. But these are policies that can be implemented in ways that do not have to hinder our students' safety. And we've heard from districts that are trying different things. Some have even considered maybe there's one phone that remains in the classroom that's available when there's an emergency. Doing so is better than having everyone trying to dial 911 in a way that gets in the way of what first responders need to be able to do. There are comparable technologies that can complement these cell phone policies. And we did a webinar for our school districts that showcased a bunch of things, including these wearable alerts that some schools are using. And it allows for someone in the classroom to communicate directly, either with the administration or with law enforcement when there is an emergency. And this is important in our rural communities where many of those communities, cell phone access is not even a real option. And so there are ways to complement the needs around safety. We just have to have these hard conversations about how we are going to limit disruptions and promote better mental health. And let's be honest, this is not just a conversation that involves students. How many of us know adults who say, yeah, I go to sleep with my phone on the pillow? How many adults, like their kids, are addicted to their device? They're cooking and they've got a device right next to them or in their hand, certainly in our cars. This is a conversation that we have to have. And, I appreciate, Jonathan, your leadership here and Trustee Melvoin for leading the resolution that got us here. We're all going to be better off for doing this, but yeah, we're going to have some hard conversations. We're going to have to work through some scenarios. We can't let the perfect be the enemy of the good, but we certainly can have good conversation. And you know what? I think we have to bring students into the conversation as much as we can, because we can make great policies and they'll find ways to get around it. But if we ask them to help us to design great policies, and again, give them the rationale to understand why we are doing this. We've got young people who are some of the best peer mental health leaders anywhere. You think they're going to listen to an old guy like me? No. When their friends are talking about it and saying, hey, it's cool to get help or go to the school-based health clinic, it is so much more powerful than what we can do. Let's bring the voices of our students into the conversation to help us design and strengthen our policies so that they're workable and they address many of the issues that we're talking about today.
Perfect. Thank you. Thank you all. We are running a little bit low on time. I want to leave 5 minutes for about 3 questions that we'll be able to get to. But I just wanted to turn to one more topic before we get to Q&A, which is the role that families play in this at home and the role that we can play on the school side to support those families. You know, at Daybreak, we deeply believe in the role of family education in the other half of the equation, right? What these kiddos are doing at home and the support they're receiving at home. And we've invested a lot in helping school districts educate families on the role of smartphones and social media usage on youth mental health. So it's very clear where we stand, but I'm curious how you all think about the role that schools can play to help educate families and really solve this other half of the equation of what these students are doing when they're at home.
Well, I can tell you one thing. Shortly after assuming my role as superintendent of Los Angeles Unified, we launched a family academy, sort of a bold effort that has educated and empowered thousands of parents and caregivers by equipping them with the essential tools, information, knowledge, right? Not only about educational programs, but also the mental well-being of kids. If we're focused on that, then educating parents on the challenges, the impacts associated with the use and abuse of mobile phones. If we inform parents in a way that they will understand in a multitude of languages, the dangers associated with, if we inform parents about the benefits specific to improved academic performance and attendance, if we inform parents about the reductions in anxiety, depression, bullying, cyberbullying, then parents are easily going to subscribe to the policy. So I think you're right, and that's why one of the most important stakeholder groups in the initial phase of our development of the policy was consulting with parents alongside teachers and students, like Superintendent Thurmond said. So hopefully, as we implement this policy, and I want to go back to something that Jonathan said earlier, why do this in schools? Because schools is where kids spend most of their awake time. They're with us about 8 hours a day. For those who are student athletes, probably extend that to 10 hours. Those whose parents work, add an additional hour or so because of aftercare. This is the one chance, the one place we have to actually modify behavior through reasonable, well-researched policy. And the idea of bringing parents in guarantees an extension of the benefits of this policy beyond the schoolhouse into behaviors that will change at home. And maybe parents will actually develop a mindset that when they go out to dinner, for example, taking the iPad or the iPhone to entertain their kids as the adults eat is the wrong approach. So I think we're onto something far bigger than just eliminating distractions in a classroom environment.
And I just want to add, Alex, to the superintendent's point. I think we need to acknowledge the whiplash that parents feel, because for years we were telling them more. We're in COVID during the pandemic. It was the kids should be online, and we're doing everything online. And we're talking about bridging the digital divide. And some families feel like, well, I finally got my kid a smartphone. Isn't that how I'm helping them with the equity here? And now we're saying, no, put it all away. And so as we've started, and Jonathan talks a lot about this as well, not just the, freedom to have technology, but freedom from technology. And how the schools that cater to the scions of Silicon Valley have been phone free for a decade. And so a lot of this is acknowledging that, yes, there is some whiplash here, but to the superintendent's point, building the education piece, which is why I didn't want the resolution to go into effect in August, but in January, because we needed the runway to win hearts and minds, if it were, and talk to folks about it. And then the other thing is, I was asked recently, like, how ambitious is this proposal? And I said, incredibly so, because we're trying to change a culture. And to the superintendent's point, you do it with the kids. And so my hope is that also when students realize how better their days are when they're not on their phones, they'll start to point out the dinner table, hey, why is everyone on their phone? Or when they see adults on their phone. And that is how we change the culture around this addiction.
Yeah, if I could just briefly add on to what Nick just said. What we're trying to do here is beyond just changing a culture. We're actually trying to change childhood. And the phone-based childhood is only 12 years old. It wasn't like this in 2010 when kids had flip phones. It's only 12 years old. It's been a complete disaster for kids around the world, for education around the world. So what we need to do, it's not just the phones, we need to roll back the phone-based childhood and restore a play-based childhood. And to do that, you have to have schools and families, because, you know, right, schools, that's half the day and family is the other half. They have to be working together to do this, to change childhood. And one of the next things that you could do that would be incredibly helpful would be just advocate for just two very clear, simple rules. One is no smartphone till high school. Parents, please, we ask you to consider delaying. If you need to text them, you can give them all kinds of other things, but don't give them the internet in their pocket until at least high school. And also social media. Do not give it to them in middle school. They need to get through early puberty. You're damaging their development of their frontal cortex. So yes, we need families and schools, and especially schools can help with the messaging. They can invite parents in, and we could all be partners to restore the kind of childhood that all of us had. Note that the people having children now are beginning to be Gen Z. So from here on in, parents are going to be raising kids, parents who were never allowed out to play. They don't know what it is to go out and with your friends at the age of 9, 10, 11, go to an ice cream store and they don't know what that is. So we've got to act fast, and we've got to help young parents to say, you know what, this is normal for you to let your kid out with some independence with other friends. You know, I'm not saying send them out alone all over the city, but have little adventures with their friends. Schools can do this. We need schools and parents to work together.
We almost need a campaign to remind everyone about the benefits here, because if you see all the benefits, who wouldn't want to engage in this activity? And we haven't even talked about some of the physical benefits of helping to swap out technology time for physical activity. You know, American children have the highest rates of diabetes, heart disease, and obesity than we have seen in generations. And so this is like everything else. We have to find ways to educate and promote. You know, a lot of parents are going to say, wow, it's really hard. You know, this thing has already been underway, and now I have to take the phone back at home and limit, and that creates an adversarial environment. We're going to have to provide education and supports. I love the family engagement that Superintendent Carvalho talked about. This is like anything else where we have to find ways to engage our families, whether we do that through adult school programs or parent engagement programs or through the state PTAs and the other parent programs. We have to educate about the benefits and remind students that there's nothing that replaces social connection. It's so, you know, Nick, it is so interesting what you said about conflicting messages, because during the pandemic, there were times when there were messages like kids should have their phone because it was the only way that they could connect when it wasn't safe to be in person. And so now we're going to have to work back from that and say, you know, now we really do want to encourage connection in a meaningful way in person that a phone cannot replace. And we're going to have to talk about great programs that you all have, like Conga Kids, where people they learn dance, but really they're learning social connection. We're going to have to find ways to just educate. And I know that we have some folks who work in mental health who are here today on this call. And I just want to remind folks that in California, we are always looking for more mental health clinicians and teachers and others, and that we offer a scholarship. They can reach out to us at teachinca@cde.ca.gov. I'll drop that in the chat. It'll give away for anyone who wants to work in our schools as a mental health clinician or as a classroom teacher. We welcome you in places like Los Angeles Unified and all across the state of California.
First, Los Angeles Unified.
You're here.
Oh, I second that, Superintendent Thurmond. You know, at Daybreak, we're hard at work trying to build up mental health capacity in our schools and supporting schools and getting the word out to families with family education programs. So if anybody on this call is looking for help in either of those areas, feel free to reach out to us. We are at our time. This is a very lively conversation. We got 25 questions. I tried to, throughout the course of the conversation, weave about 3 or 4 of those into the conversation, but unfortunately we didn't have time to get to all of them. What I will commit to is our team will go back and take a look at these questions, and if we can get answers to them, there are some really good ones here. For example, are there materials or presentations that we can use to get our district leadership on board with this. Things that we want to be able to provide practically to help you all get started. We'll go back and take a look and email out answers to any of the questions that we can get from our panelists. But thank you all for joining us today, and thank you so much for our panelists. Like I said at the beginning, it feels like we're at the start of a very important movement. Like John said, we're trying to change childhood here, and I thank everybody who's on this panel for leading the way in that. So thank you all. Have a great rest of your day.
Thanks, everyone. It was a pleasure.
Thank you. And thank you to Daybreak.